Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health and the Wellness Forum Institute for Health Studies. So, just a short list of free stuff and paid stuff coming up, lots of free stuff. First of all, if you missed our weekend conference, you can still purchase access to the online conference. And I think almost all of it's probably up by the time you're seeing this video. It was amazing. Dr. Vinay Prasad hit it out of the ballpark. It was worth the whole weekend just to see him, but the other speakers were so amazing. I learned a ton. I took a ton of notes when I was sitting there listening to the lectures. Another free thing is the Prevent Cancer workshop. For those of you who signed our Prevent Cancer pledge is this Thursday. Don't miss it. Optimal Health with Pam is this weekend, Friday night, Saturday morning, Saturday afternoon. I teach it once a year. I think we have a couple spots left, and then it doesn't come back till next year. And this will totally change your life, I promise. I'm going to show you everything from how to manage your time to solving the mysteries about should you be intermittent fasting and how much sleep is really enough and supplements and all that kind of stuff. And a short course on immunology that I think you will find helpful. ADHD is coming up also, and don't miss that. I'm going to teach that, and then I'll make a recording of it. But the live is always fun because you get to ask lots of questions. All right, so I want to talk about stents today and the high cost of healthcare. This is what Dr. Prasad talked about at our conference, and there's nobody who really talks about it more competently than him because he's still working inside that system. He sees firsthand. Well, one of the big problems is cost. I mean, we spend trillions of dollars on healthcare in the United States, and we have some of the worst health outcomes in the Western world. Some people think the answer is more government control over medicine, but this has proven to be disastrous in many places. In fact, socialized medicine has been a core value in Canada for a really long time, and the system is so overburdened that the government is now actually encouraging the development and utilization of private and independent healthcare providers. Now, this speaks volumes. I've written and spoken about this before, and people scream at me who don't live in Canada, but if you live in certain areas of Canada, this is what's going on. Here's an example of why our healthcare bills are so high, outcomes are so disappointing, and the system is so overburdened in the United States. According to a new report, every 7 minutes, a Medicare patient gets a coronary stent he doesn't need. More than 20% of all stents received by Medicare patients between 2019 and 2022 were not necessary, and the cost to the government for this unnecessary care was about $2.4 billion. The researchers reported that over 229,000 procedures, quote, met the criteria for overuse of stents. This is just one procedure, and this is across all branches of medicine, this kind of stuff going on. Now, stents are used to open arteries and restore blood flow. And they are really warranted for people who are having a heart attack. They can save your life if you get to the hospital in the middle of your myocardial infarction. But there's no benefit for people who have stable coronary artery disease and chest pain. A study in 2007 concluded that the use of stents, medication, and lifestyle changes was no better than just the medication and lifestyle changes alone for reducing deaths, heart attacks, or hospitalization. The study wasn't an outlier. Subsequent studies showed the same result, but this didn't influence practices in hospitals and medical centers. Doctors just continued to routinely place stents in people with stable coronary artery disease who didn't qualify for the procedure. Very hard to change things in institutional medicine. Of course, doctors who promote the use of stents defend their practices. Dr. Wayne Batchelor, chair of the American College of Cardiology's Interventional Council, disagrees with this report. He says that many patients who take medications suffer from chest pain, and stents can relieve the pain. It's really not quite true. The COURAGE study compared outcomes for patients randomized to receive stents or drug treatment only. At 6, 12, and 18 months, the group that got the stents reported more pain reduction. Wasn't a huge difference, but they noticed it. But by 3 years, there was no difference at all. Now, some people might argue that, well, if you got 2 years of pain relief, however it happened, it might have even been placebo effect. Maybe that would be worth it. But patients really aren't told about the potential side effects, which include tears in the arteries, infection, bleeding, blood clots that can cause stroke, heart attack, and kidney damage. Another thing that patients aren't told about is that stents sometimes have to be replaced because they don't cure the disease that leads to the narrowed arteries in the first place. Restenosis occurs when the artery with the stent weakens or narrows again. This results from additional plaque formation or scar tissue developing around the stent. The additional plaque in most cases results from the continued consumption of high-fat, high-cholesterol diets rich in animal foods that led to the need for the stent in the first place. The better option is diet change. I mean, I've been saying this for years, and the evidence just gets bigger and bigger every day that it's been true all along. Long-term adherence to a whole foods, plant-based diet has been shown to result in atherosclerotic regression, reduction in angina, and reduced risk of cardiac events, even in people who've been diagnosed with severe coronary artery disease. Dr. Esselstyn at the Cleveland Clinic has, I think his is probably the longest longitudinal study for cardiac patients ever conducted. And 38 years out, it shows the same thing. Compliant patients do not have events generally, and they don't die of coronary artery disease. Well, this approach is not only the best choice in terms of outcomes for patients, but coming back to economics, it's the best choice from an economic standpoint. Healthcare costs are reduced, but so are the grocery bills when people start eating the right foods. I think many people have the misconception that eating well is too expensive for the average person to do. I promise you that my grocery bill is lower than many people's grocery bills with optimal food, the best you can buy, and an optimal diet. And one of the reasons is some of the most expensive stuff people buy is some of the worst stuff that they eat. A new and independent healthcare system, which I think everybody would like to have, I've been talking about this a lot lately, it's going to require a disciplined approach for both practitioners and consumers. I mean, consumers are going to have to advocate for themselves and take responsibility for their health and stop asking for expensive interventions that are ineffective and not likely to help them. And doctors in a new system have to stop recommending expensive interventions that don't work as well. If we just pick up a whole group of consumers and a group of providers and we move them down the street to a different address and just keep doing what we're doing, that's not a healthcare system that's going to last very long, because the only thing propping up the one that we're in right now is all the federal and state subsidies, which a new healthcare system is not going to have. So if you are a provider, I'm offering a workshop next week. It's free, another free stuff. And by the way, free tours of Wellness Forum. Ask about those too if you're not a member and you want to learn more about that. I do a free health Q&A after it. But anyway, I'm going to offer a healthcare workshop where we're going to talk about some of the limitations, licensure limitations, things of that nature, some of the terrible things that are being done to healthcare professionals in some areas right now, and also what they would have to do, what you would have to do if you're a dietitian or a nurse or a medical doctor, whatever your practice specialty is, to move into a new system with us. And because I do intend to do it. I think it's my last third of my life legacy to create something like this. So I'm really taking it seriously and moving in that direction. Happy to share my ideas with you. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it. My email address is pampopper@msn.com if you'd like more information about any of the stuff that I talked about. And don't forget Optimal Health and Life with Pam this weekend. One time a year. This weekend is it. Don't miss it. I promise you, it will change your life. All right, have a great day, and I'll talk to you tomorrow. Thanks for watching.